Good afternoon, everybody. Welcome to our Enroll Nebraska connector intro and quick training. We are going to spend about an hour today looking closely at the Get Covered connector tool and how it can benefit you as enrollment assisters, and really how it's going to affect your workflow as well. So hopefully some interest has been generated on this. I forgot to introduce myself. My name is Eric Saviano, and I am the Enroll Nebraska coordinator based out of Lincoln. And I am going to be helping with the implementation of the Get Covered connector. So I am a good person to have in your hip pocket. I'm going to chat my email address and contact information to everybody in just a minute. But I'll go through one or two housekeeping things. If you haven't been on one of our webinar systems through this system, you should know that there is a chat box, and that's pretty much the best way to get in contact with us. We don't have a large webinar today, but it's going to be recorded. Make your questions, and if you have comments or anything, just put that information, write it out into the chat box, and me and Emily from Enroll America are going to be presenting or being able to see it. We might get to them during, we might get to it after our presentation at the end, but I think there's going to be lots of good sharing of information through this. So with that, I'm going to introduce Emily Sutton, who's a former CAC manager in Omaha and a big Enroll Nebraska supporter. And she's been instrumental in getting this tool to us, and she's going to be the one hosting the nitty-gritty and sharing the information with from here on out. So with that, Emily, I'm going to hand it over to you, and we're going to transfer this screen share over to you too.
All right. Can you hear me okay?
I can.
All right. Well, thank you for having me today. I hope that everybody had a great weekend, and I'm sure you all are extremely busy getting ready for Open Enrollment 4, and so I just really appreciate you taking the time out to learn a little bit more about the Get Covered connector. As Eric said, this is something that we've been working on to make available in the state of Nebraska for several months now, and we were really fortunate to be able to match up a partnership with one of our Texas partners, and Nebraska has been given some access to this tool, also with support through Enroll Nebraska supporting this and making it available in the state. So the purpose of today is just to take a look at the connector, what it looks like from the perspective of the consumer, as well as an assister and a user of the tool. And then learn a little bit about what we've been able to garner in terms of national trends based on the usage of the connector. As Eric said, I am from Nebraska. I work out of my home here in Nebraska. I serve as a regional contact for Enroll America. We are a national coalition for implementation of the Affordable Care Act, and so we provide support on the ground to partners like you all and supporting the work that you all do in developing coalitions, as well as sharing some best practices and training across a variety of different topics. And obviously, one of our most in this arena is finding ways to get consumers face-to-face time with in-person assisters. And so we're going to talk a little bit about this tool and how it was developed here in just a moment, but that's what we plan to do today. So if you are in the right chat room, then you should stay along for the ride. So I think probably the biggest question that folks have is what is the connector? And plain and simple, the connector is a scheduling tool. And so what you can see on this screen is on our Get Covered America website. This is our widget that we have developed.
Emily, I'm going to interrupt you, and I think we can we've been happily watching your face, so we need you to share your screen if you don't mind.
Oh, let me see here. How's that look for you?
There it is.
Is that better?
Yep.
All right. So this is our widget. Sorry about that. Technology is always touch and go sometimes. So the widget is basically, it's a embeddable digital tool that you can upload into your website. I'm going to show you in just a moment. Enroll Nebraska has a co-branded widget that is on their website that is available for you to implement into your website, or if you have, just want to flag it and use it from there. But this is available to you. We've made it co-branded for the Enroll Nebraska Coalition, and so you will have one that you can use as well. But we're going to go into a little more detail when we do the actual demonstration on what you can see here and kind of our theory behind how this is set up. So besides what is the connector, I think even more importantly is what is it that the connector does. And the connector does several things. The first thing that it does is it allows you to manage and schedule your appointments. And so when we're looking at work that assisters do across the country, a lot of times especially during open enrollment, when you have essentially a revolving door of consumers that are coming in and needing a myriad of different things. This is one tool that allows you to coordinate that as easily as possible, right? It also allows for you to keep track of many of the activities that you do and that you already report back either to CMS or HRSA, and this is a space that allows you to input all of that information and have it stored in a secure way and compliant to the PII requirements of the federal government. It also gives you a place where folks can go to one place and figure out where they have assistance available to them. So when we're talking about people that live in different communities across the country, people want to see the options that are available to them for in-person assistance, and not just, this is where I live and this is the place that offers in-person assistance. Rather, I want to see the options. I want to know where there are folks available that speak my language. I want to know where there is a place that is conducive to my physical disability or visual impairment or hearing impairment. And so this is a one-stop shop of where folks can go and figure out where in-person assisters are located, so that they can have an informed choice of where they could go for assistance. And it also allows for coalitions like Enroll Nebraska to work together and learn some things about the consumers that use your scheduling and come and see you in your in-person appointments. We can learn a lot about some characteristics of our consumers that way. So the connector does a lot of things. Beyond these 4 examples, there is a lot more that it does, but these are the top ones. To give you a little bit of background in terms of how was this tool developed and when, during Open Enrollment 1, a strong partner of ours in North Carolina figured out that they really wanted a system that their assisters across their consortium could work together on and coordinate coverage of schedules, especially since it just got so hectic. Nobody really knew what to expect during Open Enrollment 1. And so North Carolina built a similar tool, a much more simple tool that they used internally within the state. And as a national organization, one of our roles is to find out what is working for people and figure out how to connect those resources to the larger country. And so between Open Enrollment 1 and Open Enrollment 2, we decided to develop our own tool. And we named it the Get Covered Connector. And so the tool launched right before Open Enrollment 2. Since then, we've made over 1 million appointments scheduled. And of those, we've had just over, I think we just broke 250,000 appointments that were actually kept. So nationally, we have 38 states that are engaging with the tool and over 400 organizations that use the tool, whether it's as a locator tool or as an actual scheduler. We have a majority of the country is using this tool in a significant way. So that's a little bit of background. I'm going to take you now on a walk through the tool. I'm going to give you two perspectives. The first perspective is from the perspective of the consumer. We know that not all consumers have access to internet or are going to schedule themselves an appointment online, but some do. And sometimes that's just the only barrier for folks, is just how do I get that appointment? And calling and getting a phone number to follow up on, it just doesn't give you that streamlined customer service. And so if we have a place that we can direct consumers to, like the Enroll Nebraska website or your local website for your organization, then somebody can go in and search for their own appointment and schedule that online, which is actually a really popular trend right now. In the healthcare world, folks are going online and scheduling their own appointments, following up with their providers and messaging them. So this really is aligning with some of our larger trends in healthcare. So for today's example, I'm going to direct you to the Enroll Nebraska website. So we have embedded the widget. This is the co-branded widget here. It's got the Enroll Nebraska logo here and all of the information that a consumer or an assister would like to ask available. Looking at this widget, when we were developing the tool, we thought of what are the things that consumers really would like to see when they're engaging with the tool. We looked at the option of doing a calculator as kind of a pre-assessment. We looked at doing some more in-depth questions and screening to be able to really identify what that consumer might be eligible for or what the best next step is for them. And what we found, based on a lot of surveying and testing that we did, is that consumers really just want this simplified. The fewer hoops to jump through to get an appointment, the better for the consumer. And so you can see here there are only 3 data points that we are going to collect in terms of finding local help for a consumer. Zip code, the radius within which you would like to travel, and then your language preference. And as you can see, the languages that are available here are a large variety. It is by no means an exhaustive list, and if you provide services in a different language than any of these that are available here, let us know, and we're happy to add them because that is absolutely something that we can do. So we're just going to leave it for now at the default of all. And since we do have some schedules available in Omaha, we're going to go ahead and take an Omaha zip code and use that as the example. So you type in your zip code, the radius you want to search within. This is defaulted at 25, but you can adjust that. If you're in a rural area and the consumer may be willing to drive into town or to a different town for services, then they can adjust that as well. But we're going to leave that at 25. So when we search for help, you're going to see that there is a large list of in-person locations that somebody can get an appointment. Now, you may be curious, where did we derive these lists from? Well, the initial upload was from healthcare.gov. And so if this list hasn't been scrubbed and updated and adjusted yet, you may see some old locations. If you ever do, just flag that for me and I can go in and I can take it down so that it's not in there. But what you'll notice is at this very top appointment, we have the ability to schedule online. If you are a user of this tool and you have a schedule active through the tool, and that's going to happen, we're going to show you how to do that in the next webinar, then your organization will filter to the top. So any organization within 25 miles of this zip code that has a scheduled appointment or schedule available, they will come to the top of this list, and it will be in order of location to the central point of that zip code. So in 68110, the closest organization that has a schedule available is through Resolute, and it's in zip code 68114. So since that's the only one that we have available to actually do the scheduling, I'm going to click on there. But in the case that you know, you want something closer that just doesn't have a schedule
Hey,
available.
Emily, we're having a little technical. Can you say hello one more time?
Yeah, can you hear me okay?
Yep, sounds like you're back. Okay, I'm gonna.
Okay, just interrupt if you're having any trouble hearing me. So we're going to go ahead and schedule with the Resolute Omaha office here. I'm going to show you what the process looks like. So when we look in this next screen, it gives us a summary of the location, address, phone number, and I can also click and it will show me a Google map. And you'll notice here that Resolute has also identified themselves as hearing impaired, visual impaired, and physical disability friendly. So folks that have those needs can tell that they will be able to get support at that appointment. So here we decide, is this an individual or family, a group application, or shop application. About 90% of the appointments that we have across the entire users of the tool is individual or family. And then in terms of the date range, we can specify, I only want appointments this week, I only want appointments this month, or anytime, and it's going to give me the options that are available. So as you can see, there are several options available to me this week and moving forward. Let's just say, for the sake of the example, I want to get an appointment for tomorrow at 2:45 p.m. So I'm going to go ahead and select this appointment, and this takes me to the schedule screen. Again, it's going to remind me what the location is, the date, the time, and how long the appointment is scheduled for. And here I can go ahead and put my name here and my email address. I'll just do my Enroll America, and I'm going to do my cell phone. And when I click here, I can unclick this Receive Email Updates. Essentially, the types of updates that we send are reminders, particularly around deadlines for enrollment. So around December 15th, we may send an email reminder to consumers that, you know, remember to schedule your appointment, select your plan so that you can have coverage starting January 1st. It also allows us to send an email reminder for their appointment time and let them know that they've scheduled an appointment, where they need to go, any special message that your organization would like to post. We're able to include that in an email. And then we also send a follow-up email the day before their appointment, just reminding them that they have an appointment, and if they need to cancel or reschedule that, to contact the assister. In here, we also have some consent language. And so by scheduling the appointment, the consumer agrees that Enroll America may share their contact information with our assister partner on the ground. So the way that this goes is we're collecting this information on behalf of Enroll America, and then we submit the information and send it to the assister by way of an email reminder to the assister. And then this makes the transaction and the exchange of information PII compliant per federal regulations. So when I schedule the appointment, I will get a confirmation here shortly. It may take a moment. There it is. So my appointment has been confirmed, and it gives you just a summary and a reminder of the appointment information. And then I have the opportunity here, I can add this to my calendar. So if I use Google Calendar or Yahoo Outlook, if I click on that, it will transfer that information to my calendar. I will also get a text message, and I haven't gotten it in my phone yet, but it will send you a text message saying, your appointment is confirmed, here's your details, and then any instructions on there as well. So this is the extent of what the consumer experiences. I want to give you a chance here to share any questions. I can't see the chat box, Eric, so if you see any questions that come up, I'm going to give it a few seconds since we have a little delay for folks to share any questions.
Emily, we couldn't hear that last question. We're getting some robot sounds with your voice for some reason. Like the web connection isn't the greatest, so can you repeat it?
Yes. I just wanted to open this up for any questions if folks have anything at this point they'd like to ask. Can you hear me okay, Eric?
We missed that again. And then I could hear you say, can you hear me, Eric?
Just opening it up for questions at this point.
Okay, some folks can hear pretty well.
Okay.
So no questions right now for Ashley. So
okay.
Anybody else?
Well, while those are coming in, and I apologize if there's any issues. I can hear everybody okay, but just stop me and I'm happy to repeat if there's a question or you can't hear me out. Okay. Something that I do want to make sure to share is that we've done a lot of research in terms of the success of this type of a tool and what works for consumers to ultimately get enrolled. And we found that if a consumer is reached 4 or more times, whether that's via text message or an email message, a phone call, and an in-person conversation, they are 33% likely to become enrolled. So they have a much higher chance of being enrolled than somebody who has one interaction. On average is about 20% likelihood of being enrolled. So we have built this tool to, before you ever even have contact with a consumer, that they get 4 touches. They get an email confirmation and a text message confirmation at the time that they schedule their appointment. Then they also get an email reminder and a text message reminder the day before their appointment. As a best practice, our partners typically call prior to the appointment just to confirm and introduce yourself. Hey, I'm Emily. I'm the certified application counselor, and I'm going to be helping you with your appointment tomorrow. Just want to remind you to bring, and you can tell them what they need to bring or any special instructions that they need to know, just to have that warm touch leading up to the appointment. And if you do that, then that's 5 touches that you've done before even meeting the consumer. Okay, so I'm going to switch over here. Can you hear me okay, Eric?
Yep, I can hear you. Sounds like everybody can hear you but me. I wanted to make sure you saw these 2 questions. Does the connector work with EMR calendars? And is the tool available in Spanish?
Okay. For the second question, yes, the tool is available in Spanish, and both for consumers as well as users. So there is an assister version that is available in Spanish, which is the screen that I'm showing now. This is the back end of the tool, and the widget is available in Spanish as well. And so if there is interest in that, we can certainly send that along.
I'll let you know too that Enroll Nebraska has that up on our website under the Spanish language pages at the Get Local Help in Spanish.
Yeah, and embedding the widget into your website is so easy. So obviously, we want to make sure that as a state and as a coalition, we're directing consumers to a centralized location. We know that that's a best practice. But if you also want to make sure that as consumers are visiting your health center website or your organization website, that you can also have this available there as well. And in terms of data tracking, we have the ability to find out how many hits the widget has had based on those different locations as well. So we can really figure out some trends in terms of where we're seeing a lot of traffic and sending people. But I think Eric and I would agree that sending folks to the Enroll Nebraska page is also a really great resource for consumers in general and assisters to have access to a lot of other resources that are available there. And in terms of the EMR, so currently, because there are so many EMR products that are out there, it is not, in terms of the scheduler on the tool and the compatibility with the individual health health record scheduling tools, it is not currently adaptable. However, as you saw, as I went through the demonstration for the consumer, the assister can also embed those appointments into their Outlook or Google or Yahoo calendars as well. So if your organization uses Outlook as its email system, you can appointments that are scheduled and have those imported to your Outlook calendar as well. But in terms of the EMR, currently that's not something that it's capable with. Any other questions? Okay, then I am going to walk you through what it's like to be a user in terms of an assister on this tool. So this is kind of a behind the scenes peek under the hood of what it looks like. So this is going to be kind of a fairly brief overview, because we're going to go into much more detail in terms of developing your schedule at a later webinar. But for the purpose of giving you an idea of what this does and how it works. So the admin tab here basically is where we develop users and give permissions to different users and other administrative tasks. So most people will not use this tab in any particular frequency, with the exception of like Eric and I, because this is where we give permissions to folks and give logins and make sure that people have access to the tool. When we go over to the organizations tab, this is actually where we build the data infrastructure. So for organizations, we identify who are the different groups.
I'm really sorry.
Yes?
Okay. It looks like we've had some kind of major technical difficulty. Looks like somebody said the presentation started over and is replaying. Okay, all of them are saying that, like they had the lost connection. Okay,
yeah, that's weird.
That's really. I tried to move locations so that I could hear better, and oh, okay, there we go. Angela refreshed and now can hear me.
Okay, can everybody hear me okay?
Hit reconnect at the bottom. Okay. Please hit reconnect at the bottom of the screen. Okay, Emily, would you mind starting back at the dashboard back end of the tool with admin and then going over to organizations?
Yeah. Can you all see this okay now?
Yeah, I see it.
Okay. Not a problem. And I just want to check and make sure that folks can hear me okay. Somebody can just give a thumbs up or something.
Lots of yeses.
Perfect. Okay, so we will push through. Okay, so the screen that you're looking at now, this is the admin side. And just, I also want to make sure to tell you, this is not the live version. This is the training version. So you can see up here, it says training. So there is no actual consumer data in here. It's all fake. So in terms of the way that this works for users, we have 5 main tabs across the top. And I'm going to walk you through the different tabs and what they do and kind of how they may be important for you to use at any given time. So this first tab is the admin tab, which is essentially where Eric and I will build out access to different users. This is where we give permissions, we create users, identify who they're associated with, we hand out logins to different organizations depending on the number of people that are interested in using the tool. So this is really a tab that you may or may not have any access to besides the FAQ. Then we go over to organizations, and this is the tab where we build the data infrastructure in terms of identifying who are the different groups that are using the tool. So that is the organizations tab. And Nebraska, we have multiple partners that are going to use the tool. So each of you will have your own organization identified, and your data will be siloed from everybody else's data. So that's something else I usually get a lot of questions on. Your data will be protected from other people having access to, with the exception of Eric and I being able to access the entirety of the Enroll Nebraska tool. And that is so that we can provide tech support, do reporting and things like that. In terms of locations, this is where we identify where people will actually be sitting down with consumers in the physical location. If you're an organization that does a lot of outreach, or you do enrollment at different enrollment stations throughout the community, you will be able to identify what those different locations are. Then we have assisters. And the assisters are the folks who actually do the appointments. So there is a difference between users and assisters. For example, some organizations have users that are front desk or receptionist staff or telephone staff that are able to make an appointment with an assister. And the assisters that we have listed here are the people who actually put schedules up and do the in-person assistance. So that's the difference between a user and an assister. And then we have the ability to specialize a message that you would like your consumers to see specific to your organization when they go to schedule an appointment online. So that can be something like, specific parking instructions. It could be specific languages that you want to make sure that they know they need to bring an interpreter for, or whatever that might be. But this is where we build data infrastructure for the tool. The scheduling tab, which is the tab that most assisters will be engaging with the most, is where you actually build your schedule out. You specify appointments, and you can manage the appointments that you have coming up. You can pull a report to see what your appointments look like in the next day, so you can call and do your reminder appointments. And this is essentially where the rubber meets the road. And we will do a deeper dive training on this tab in the next couple of weeks. And then here, outreach events. This is actually just a warehouse for people who report to CMS on outreach events. I guess I can show you kind of what that looks like. But when you schedule an outreach event, or you're going to do an event in the community, this is where you can put all of the information for the event date, the location. You can keep track of what type of an event it was, any organizations that were providing support at the event, any assisters that were there specifically, and then the data that you report on in terms of assists and things like that. So this is what the outreach event tab is. And then in reports, and again, I'm not going to go into detail, but these are the different reports that we have created that are available for users to pull. So the CMS reporting requirements are fully built into this tool. So appointments have fields for all of the detailed reporting that you need to do for CMS. We also have the ability to pull reports on multiple levels. So thinking back to this organization tab where we differentiate the different organizations, locations, and the assisters, we can pull a report, for example, from everything that's ever been done in the entirety of your contract since you started using the tool as an aggregate, all the way down to a specific single assister's report for a specific day for a specific location. So the reports are very diverse in what you can pull. We also have the ability to do modular reporting, so you can select what fields you specifically want to pull if there's a particular report that you want to have very particular information and not the rest. That's something that we're actually going to be debuting in the next couple of weeks. So this is the tool. That's what the consumer sees. That's what the assister sees. Today is just meant to be an overview and just an introduction. But if anything, it gives you kind of a visualization of what the tool does and what it looks like. So in terms of what have we garnered from using this tool, we know that the tool continues to be very effective. It allows organizations that have a lot of responsibilities across different geographical communities with large teams and teams that are cyclical. So I know that a lot of folks are currently recruiting to bring in new navigators or new CACs into their work, or starting to build out volunteer programs. So this is a way to streamline scheduling in a way that allows for organizations to focus on what they're best at, and that is helping people in their appointments. It also allows for kind of that one door access for consumers to get help. And it makes it easier to, like I said, organize your program and be more effective in what you do. But for consumers, this is a really confusing process. You know, do I go to healthcare.gov? Do I call 211? Do I go to my health center? Who do I talk to? This is a way for us to easily market that you can get in-person assistance, and it's as easy as a few clicks. And if you have consumers that are not using the internet or don't have access to it, helping build teams within different organizations in your partner network and using the tool for you. So different social services agencies or hospitals or other partners that typically refer people to you, let's get them familiar with the tool to be able to help their clients to get access to an in-person appointment with you. And this just is a way to make it easier. Also, having a centralized reporting, the appointment management is really very convenient. And then also being able to do all of that means that we're able to reach more people. Like I said, since open enrollment 2, we've had 250,000 appointments kept. That's a lot of appointments in the country using just one tool. So we do know that that allows for higher impact in the enrollment world. Something to keep in mind is that in terms of assisters and the schedules that are made available, we know that Tuesday at 10 o'clock in the morning is the most widely available appointment time. So it looks like Tuesday mornings is a busy day for assisters. A lot of people are doing enrollment assistance at that time. However, the most popular day is Saturday mornings. So if you aren't doing enrollment on Saturday mornings, that's something that you may consider doing during at least the open enrollment period. But we also saw that mornings in general are good times for consumers. They prefer to come in the mornings. We also garnered in open enrollment 3 that December 15th was the biggest day for appointments. That's not surprising, right? We know CMS did a lot of promoting that December 15th deadline. And I know that a lot of partners of mine noticed that that December 15th timeframe was even more busy than the January 31st timeline. So having schedules up and running as early as you can in open enrollment is important to make sure that we can get folks those appointments. We also know that partnering the tool with your general follow-up and reminders really helps to keep those appointments kept and scheduled. So doing the email program, the text message, and follow-up verbally really allows for consumers to feel connected and really wanting to follow through with their appointment. Something else that we were able to take away from data in the tool is that folks that live in more rural areas and Spanish-speaking individuals were more likely to show up to their appointments. They had a higher completion rate in getting that in-person assistance. So that's the tool. I wanted to make sure to leave plenty of time for questions. This may be the first time you've ever seen the tool or heard anything about the tool. So I know that you may have some things that you would like me to answer for you. So I'm going to go ahead, Eric, and unshare my screen, and so we can look at each other on camera.
Okay, sounds good. So we have questions. If you would, please put them in the chat box to the bottom right of your screens. I see a couple that have come in already. So the first one for you is, does this tool have the capability for a consumer to simply request that an assister contact them via phone or email rather than setting up an appointment? Will it have that capacity in the future?
Can you repeat that again, what the question was? I think I got it, but I want to make sure I did.
Yeah, and quick point of technicality for you, there is a, on the screen, to the 4 icons down from the screen share is the Webinar Jam Studio, which should have the chat function for you to look at the questions as well. It's white with a lightning bolt.
Got it.
Okay. So I'll repeat, does this tool have the capability for a consumer to just request an assister contact them via phone or email rather than an appointment?
Yeah, currently the tool is to schedule in-person appointments. There is the capability of having a waiting list, and that's one of the things that we'll go through in our deeper dive, where folks that are not quite ready to have an appointment can be put on a waiting list. So for follow-up, there is also we have another tool that's available for collection of what we call uninsured IDs. So when you are identifying somebody in the community that we know is uninsured, but maybe aren't ready at this time to actually do an appointment, or you do outreach and you have a list of people that you can follow up with written consent, of course, we do have some ability to keep track of those lists versus just sending them an appointment or scheduling them an appointment in the tool. So we definitely don't want those folks to fall through the cracks. But in terms of using the connector, it's primarily a scheduling tool. So I'm happy to get you some more resources and information, but if that's something that you're interested in, there's certainly resources that you can use.
Okay. Another quick question. Where do we need to go to make sure our agency information is updated? From Andrea. So, and that I would like to add to that question. So I've uploaded a lot of the enrollment assister information from the state. Is that information what is automatically shown, or is it still archived data from the past that shows up when people search these days?
Yeah, so what we would need to do, and we probably meaning you, Eric, is look through the list that we have and scrub it down. So if there are locations that are no longer active, we want to make sure we take those down so consumers don't go to the wrong place. This is a consumer to make sure that we're not misdirecting anybody. But until somebody does that and goes through and lets us know, then you know, they're going to stay on there. But it is something that we're working on every year. We go through our connector partnerships and we ask for a clean list. And so we're actually going to be doing that in the next couple of weeks. So we will, if you see something that you know is inaccurate, you can email Eric and or myself, and we're happy to go in and take those down.
That sounds good. Okay, any other questions, please put them in the chat box. Since there aren't any in the queue, I am going to give some next steps. Actually, one just popped in. So CMS is also scrubbing their lists, and I think we can help facilitate that as well. Ashley mentioned, so
Yeah.
we can help. So like Emily said, there's a lot more to learn about the scheduling part of this, and we are going to take care of that on another webinar, or at least, if we'll see how this recording turns out. If this is not salvageable, we might have to record this and that quickly and then answer questions based on that recording afterward. But we'll try to make sure everybody is in a good spot to replay this if they need to. We're shooting for October 12th in the morning to do another one of these webinars to do the next steps. So like I said, if you have more questions, keep putting them in that box while I keep giving next steps. I'm going to copy and repost another one of the comments I made earlier to show interest in using the in using the tool. There's a Google form that we're having folks fill out. You can identify how many people in your organization would like logins. We have 100 to distribute around the state. So we already have quite a few filled up, but I'm not going to be a salesman and tell you that we do it now. There is time, so make that decision and we can walk you through getting up to speed no matter when that happens. So I'm not seeing any. Yeah, go ahead.
Can I speak to timeline just a little bit?
Yeah.
So we find that the sooner that we can get, especially new users, acquainted with the tool, familiar with it, how it works, kind of work out some of the intricacies of it, and just become more familiarized with how it works, the more effective it is. And so we always want to make sure that we give assisters at least 2 weeks before open enrollment to develop your schedules and, like I said, play with it a little bit and kind of become more aware, figure out how to embed it into your Outlook calendar or another calendar if you use a different calendar program. But so my goal is to, by about October 15th, have supported all of you in doing that. For those of you who are going to use the tool, we'll get you access, you'll have a login, you'll be able to play with it a little bit, and then open up your schedules to then start promoting that on the widget so that consumers can schedule themselves or your partners can start to schedule clients' appointments with you.
Okay, sounds good. And that puts some urgency on us for sure. We're coming up on October 1st, so we're on schedule though, and I'm glad there are so many folks on this webinar. We're going to try to get more viewing the recording, and the next webinar will for sure distribute to you all as well. So if there are no more questions, which it doesn't look like, Emily, do you have any final thoughts?
Just want to again reiterate that I'm available to answer questions. I'm sorry for all of the technical challenges. We'll definitely want to redo this and re-record it, Eric, so that it's a lot smoother. But if you have questions about the tool or you want resources or some of our data citations, just let me know and I'm happy to get you those resources. I know some of you need to consult with your organizations and decide, if this is something that you would like to pursue, but it is being made available to you free of cost, which is a really nice advantage. And all of your reporting functions are built within the tool. So if you have questions, please reach out to me. I'm happy to support you.
Thanks, Emily, for being on this and for continuing to support our coalition. So everybody, again, sorry for the technical difficulties, but hey, you get 10 minutes back of your day, even with those. So have a great day, and we will talk to you later. Bye-bye.